Hello, this is Nikki Armstrong, nurse practitioner from Armstrong Telehealth LLC. This month we're going to talk about the different options in contraception. First, let's talk about uses. So we use contraception for different things other than birth control. We use it for acne, PMS, period problems like heavy bleeding, heavy cramping, menstrual migraines, ovarian cyst, and PCOS. This is the kind of a chart of the menstrual cycle and what happens. I just wanted to kind of explain this to show how most of the hormonal birth control shut down ovulation, or how they work to prevent pregnancy. So this here is in your ovary. This is the follicle that releases the egg. This is the hormones that are released from your brain in your ovaries. So your brain sends hormones to your ovaries, telling them to make hormone. That hormone goes back to the brain and shuts that down. How hormonal birth control work is really progesterone. It kind of keeps your level up here, so your brain kind of shuts down the ovaries. It just says, hey, we've got what we need, so just go to sleep, to prevent ovulation. This is the lining in your uterus. So you're bleeding here, you're shedding your lining from the month before. And then over the rest of the month, it starts getting thicker in preparation for a fertilized egg. If there is no fertilized egg, then you start the whole process all the way over. This chart is from bedsider.org, which is a great resource for more information. But we're going to talk about these top tier first. So by top tier, I just mean most efficacy to prevent pregnancy. I see there's just one pregnant woman here, and then as you go down, they get a little bit more. So let's talk about sterilization first, because I don't really have a slide on that. Sterilization for men is going to be a vasectomy. It's an outpatient visit. They just do local numbing to do it. You're out the same day. You would likely go back to work either the next day or the day after that. For women, it's a little more involved. It's actually a surgery, so it involves anesthesia. The recovery time is also a little bit longer. We'll talk about the implant first, or Nexplanon is the only one in the U.S. right now. If you see here on your right, this is what it looks like after it's put in. Most women will have a little bit of a scar here from where we put it in, but other than that, that's what it'll look like. This is how we put it in. So we clean it really good, and then we put numbing medicine all through here, just so you won't feel us put the implant in at all. You'll have some pretty significant bruising the next day, but you're going to go back to work same day we put it in. It's proven to prevent pregnancy for 4 years. The Nexplanon manufacturers say 3 years still, but we do know now that it's 4 years efficacy to prevent pregnancy. It works by preventing ovulation. It also thickens the cervical mucus so the sperm can't get inside the uterus. The most common concern I get before deciding on the implant is, does the implant move around? Is it going to break? Things like that. With the new method that we put in the implant, it's very unlikely that it'll move. It's very rare. I'm sure it can happen. It doesn't. It can bend. I have not seen one of the Nexplanons break. And if it breaks, it's still, we'll still get it out. To get it out, we just numb it a little bit, make a teeny incision, and pop it out. The most common complaint I get after the implant is the irregular bleeding it can cause. About a third of the women will have irregular problematic bleeding. There are some things we can do in the office to prevent or to fix that. So it's not a showstopper. It's still working to prevent pregnancy. We don't have to take it out if you're bleeding. We can stop it. Women get concerned about weight gain with hormonal birth controls. This one, it's very rare. It's not very common at all, but it can cause weight gain in a few women, not very often at all. The next ones we'll talk about are the intrauterine devices, or the IUD. So this is where they sit inside your uterus. This part is in your belly. So that's your ovaries, uterus, that's inside your belly. So you should not ever feel the IUD out in your vagina, which is down here. You may feel these strings, which are here just so we can pull it out. They pull out like a tampon. There are two different types of IUDs, the progesterone IUDs and the non-hormonal IUDs. The progesterone IUDs, there are a few more of them on the market. So Mirena and Liletta are kind of the highest dose. They prevent pregnancy for up to 8 years. And these work mainly by keeping the egg and the sperm from ever meeting. It just makes a toxic environment inside the uterus for egg and sperm. They also thicken the cervical mucus so sperm don't get inside. And then you have lower doses as you go down. So Kylena is good for 5 years. Skyla is for nulliparous women or women that have not had a period. It's good for 3 years. There is some pain with the procedure. It can be pretty intense for about 5 to 10 minutes, and then you're fine. You can go back to work same day usually. If you take Motrin and things like that, if you do decide to have an IUD put in, it can really help with some of that. These will likely stop your period. About 85% of women will not have a period at all when using progesterone only IUDs. You can have some irregular spotting and cramping up front, but it's likely going to stop your period. With that said, it will not stop ovulation. So you'll still be ovulating. That progesterone is just keeping the uterine wall really thin so you're not having any bleeding every month. So if you have PMS or headaches with your period, this is not going to fix that. Likely not going to fix that. But it will help with really heavy periods or heavy cramping with your periods. The non-hormonal IUD or the Paragard is the only one that's in the U.S. It prevents pregnancy for up to 12 years. Again, it creates that toxic environment. The egg and sperm never meet. Same type of procedure to put this one in. You will have whatever your regular periods are. It's non-hormonal, which women like because some women are really sensitive to hormonal side effects. So that's the first tier. Now we're going to talk about the second tier. This poster used to be hanging on my office wall. It's just kind of an example of how many different pills are out there. And there are more than this out there. So if you don't like one pill, doesn't mean you don't like all pills. There are things we can do to fix some of it. Like if you have irregular spotting and it lasts, longer than a few months, we can definitely change whatever pill you're on. There are two major groups of pills. One is a progesterone only pill, which is pretty much safe for everyone. And we'll talk about those first. See, there's very few of those. That's just this one right here. And traditionally, we've only had one type, that's norethindrone progesterone. It's a low dose, and it's not enough to stop ovulation in most women. So its main method of preventing pregnancy is it just thickens cervical mucus. It gets in your system fast and it gets out of your system fast. So you have to take it at the exact same time every day. It is safe for breastfeeding. This one is just not as effective as other pills as far as preventing pregnancy. So we usually do it in what's called subfertile women. So women closer to menopause, breastfeeding women. And they did make a pill, Slind is the brand name. It's the only one on the market right now that has drospirenone in it. It's a higher dose of progesterone. So it's it is more effective in preventing pregnancy. But they're still really expensive. That brand is. And any of the progesterone only, they can cause irregular bleeding, or you may not have any bleeding at all. The next type, which is the biggest group of pills, is estrogen and progesterone. They make low dose, medium dose, high dose. They make a triphasic, a biphasic, meaning the hormones just kind of change doses throughout the month to mimic your natural cycle, or try to mimic your natural cycle. There are a lot of options for estrogen and progesterone. You have to take it every day. It's a pill. It's not as, you don't have to be as strict. You can be, more than an hour off if you sleep in one day of taking the pill. You can control periods with this. That's what the estrogen does. You can have a period every month, every 2 months, every 3 months. You don't have to have a period at all because you won't build a lining if you take just the pills every day. If you skip those placebo pills at the end of the pack. The most common side effect is irregular bleeding. which can be fixed just by changing whichever pill you're on. There are some risk for blood clots, which can be life-threatening with estrogen-containing birth controls. So they're not safe for everyone. For example, women over 35 that smoke, they're at higher risk for blood clots anyway, so it's not one we would put them on. Most women do just fine, and blood clots are very rare, but they are possible. So the patch is estrogen and progesterone as well. So it's one you change out every week. And in the picture here, it shows the different locations you can put it. The side effects are the same as the pill, just because it is estrogen and progesterone. So it still has, the slight risk of blood clots, things like that. The only difference is it can cause some skin irritation. The vaginal ring, there are two types. There's NuvaRing, which is one you would change out monthly. And then there's Annovera, which is one you would change out every year. So you can see the one in the picture is a NuvaRing. It's kind of the size of a hair tie. It's flexible. The Annovera, which is a year long, is just thicker than that one. And you kind of just squeeze them in half, put them in your vagina like a tampon. They sit in there for 3 weeks, take it out for a week, and put a new one in. Again, though, you can control your period with this one because it has estrogen and progesterone. So if you don't want to have a period, you don't have to. You just leave it in for 4 weeks and then replace it. Again, same side effects. The difference is you can have some vaginal irritation with the ring. The shot, Depo-Provera, it's an every 3-month shot. They do have ones you can give yourself at home now, but most of the time you do have to go back into the clinic to get a shot every 3 months. It will likely stop your period. Depending on where you are in your cycle when you get Depo, you may have a long period of bleeding before you get to that no period. To prevent that, you can do it like at the end of your period, get your shot, and you're less likely to have bleeding then. It prevents ovulation. Weight gain is a concern with the shot. It can be a significant amount of weight, like 20 pounds and up. That's not everyone, though. That's just some women, not everyone. Okay, so those are kind of the hormone prescription birth controls. Now we're going to talk about this, the bottom tier, which aren't as effective. They're good backup methods if you're really concerned about, if you cannot get pregnant right now. So for instance, condoms are a good backup method to these, and they're the only method that will help prevent STDs. So there are two types. There are male condoms and female condoms. Male condoms are the ones that you can buy at any grocery, gas station, pharmacy. They're very affordable. They've likely got them free at your local health department. Female condoms you have to get from your provider's office. Some health departments may have them. It's just kind of a bag at the end of a ring that you put up in your vagina. The ring stays outside of your vagina, and it works the same way. It's just a barrier. The fertility awareness method, there are a bunch of apps that will track your monthly cycles and tell you when you're most fertile. And to use this method, you would just avoid sex on those days. The only one that's FDA approved is Natural Cycles for this. Diaphragm. They do have a diaphragm now. It's one size fits all. This one is a prescription that you would get from the pharmacy. You have to use it with spermicide, and there are some rules to it. Like you have to leave it in 6 hours after sex, but no longer than 12. And you have to, if you have it in for 2 hours and are going to have sex again, you have to put more spermicide in. So just make sure that you're following the directions on it, and there are good YouTube videos that describe how to do that. Withdrawal is the last one. That's pulling out right before the male ejaculates. Again, not the most effective, but they're all pretty effective compared to not using anything at all. So if you guys have any questions, please feel free to reach out to me. I'd be happy to see you in my clinic. You can book online. There's my website, or give me a call. I'm charging $60 flat fee right now for each appointment, and I would be happy to see you guys.